Hello and welcome to New Horizons in Health, bringing veteran healthcare into the future. My name is Sharif El-Nahal, and I'm honored to serve as Undersecretary for Health for more than 9 million enrolled veterans across the country who get care from our healthcare system. And I'm really excited today to talk to the Surgeon General of the United States, Dr. Vivek Murthy, Vice Admiral. He was confirmed by the U.S. Senate in March of 2021 to serve as the 21st Surgeon General of the United States. And as the nation's top physician, he helps to advance the health and well-being of all Americans and has worked to address critical public health issues since his tenure this time, but also in the second term of the Obama administration years ago. He's issued Surgeon General advisories on the youth mental health crisis and social media's impact on youth mental health, the epidemic of loneliness and isolation, which we're going to talk about today, and of course on burnout in the healthcare worker community as well, which is an issue that affects our healthcare system and every healthcare system across the country that serves Americans. He also issued a Surgeon General's framework on mental health in the workplace and is the first Surgeon General to host a podcast called House Calls with Dr. Vivek Murthy. So Dr. Murthy, you can grade us on how we do today with this one.
You're doing great already. I love it.
So thank you so much for joining us on New Horizons, and we'll get started by a really important program that you started recently, Dr. Murthy. The advisory that you released recently is called Healing Effects of Social Connection and Community. And veterans across the country are dealing with social isolation and loneliness at record rates. And we're, of course, concerned about that in the VA. We'll talk a little bit about our programming in a moment. But can you tell us a little bit about what you, as the nation's top doctor and public health official, want to look into this issue across many other issues that cross your plate?
Well, thanks, Sharif. And I'm so glad to be with you today. So glad that you started this podcast. And I just appreciate your service to veterans around our country. You know, this issue is one that is impacting veterans. It's impacting millions of people around the country. But the truth is, Sharif, like in medical school, I never learned about loneliness or isolation. I never really thought about them as health issues, even though I had in my own life experienced loneliness and isolation at various periods as a kid and then later on as an adult. Even though as a doctor, I had seen patients who were struggling with loneliness and isolation, but somehow I didn't quite know like what the health impact was. But when I first began my tour of duty as Surgeon General, I started hearing from people around the country who were telling me stories that sounded like loneliness. And I heard from college students, for example, who would tell me that they were on campuses surrounded by thousands of other students, but they felt like nobody knew them and they couldn't be themselves. I spoke to veterans, actually, who told me that the intense feeling of community that they had when they're in the service, when they're deployed on tours of duty around the world, that evaporated once they left the service. And even though they came back to a hometown sometimes that they knew, that seemed familiar, they didn't have a sense of community. They didn't have people who knew them. And I heard also from CEOs, from members of Congress, from teachers, from parents, all of whom were living their busy lives, but were feeling that they just didn't have the kind of relationships that they wanted and needed with people that they could trust, people they could go to in a crisis. And all of this, it turns out, has taken a real toll on our health. You know, as spurred and inspired by those conversations, I started to dig into the research around loneliness, and I learned two really important things. One is that loneliness is extraordinarily common, with 1 in 2 adults in America living with measurable levels of loneliness. By the way, the numbers are actually much higher among young people, which is counterintuitive, despite sometimes because of their use of technology. But the second thing I learned was that loneliness and isolation are really consequential for our health. They're more than just bad feelings. It turns out when we're lonely and isolated, our risk of depression, anxiety, and suicide go up. But surprisingly, our risk of physical illness go up as well, with an increase in the risk of heart disease and stroke, of dementia, and premature death.
You know, it's really interesting that you mention how common loneliness is, but also your point about what veterans feel after transition. That's something I hear in veteran roundtables across the country. And it's often the case that veterans tell me that it's another veteran, a battle buddy, somebody who experienced similar trauma during their service that helps them get into care. So can you tell us a little bit about some of the recommendations in your advisory that speak to that advantage that peers have in getting folks the care they need, but also to a better place so that they don't have some of these health risks that you described associated with loneliness?
Yeah, and this is actually one of the parts that I find really encouraging is that when you actually understand the challenge of loneliness and start to look at solutions, you realize that you actually, even though there are health risks associated with loneliness, you don't need to be a doctor or nurse in order to help somebody. You can be a family member, you can be a friend, you can be a concerned neighbor or community member. And so there are a number of recommendations that we laid out in our advisory last year on loneliness and isolation. And there are policy steps we can take, there are programs we can build in our communities. And I'll speak to that a little bit, but let me just start with the individual things that we can do. All of us can take time each day, just a few minutes even, to check in on somebody we care about in our life. It could just be a phone call on the way to work to say, hey, I'm thinking about you, I want to know how you're doing. But those small moments actually add up to a big difference in terms of how connected we feel. And you never know when that 5-minute call is going to make a massive difference in someone else's life. It's happened to me at times that I've been going through a really hard time, for example, and then a friend will call just for a few minutes and we'll chat, and I'll feel so much better. I'll feel like, gosh, I feel connected to someone again. I'm reminded of these wonderful moments we had in our friendship together. They may have no idea. They might just think, oh, I just call for a couple minutes to check on someone. So it's just a reminder that checking on each other is more vital now than ever before, especially given how many people are feeling lonely. The other thing we can do, though, is we can also look for small ways to help people each day. If we can do one small thing each day to help somebody, whether that's helping a coworker who may have spilled their coffee, or spending a moment to chat with somebody after a meeting when you notice that they were quiet and maybe having a hard time, or helping a neighbor who might be struggling to rake their leaves, in their yard. These are just small moments that actually add up, because it turns out that service to others is one of the most powerful antidotes to loneliness that we have. So these are small things we can do as individuals. I would also just urge one more thing on the individual side, which is to think about how we can re-engineer our relationship with technology. For many of us, myself included, we have struggled probably with how we manage our phones, with perhaps with our use of social media. And the thing about our devices is that they give us this promise of connection, of enabling us to talk to anyone, understand what's happening in people's lives at any given moment. Yet that is a bit of an illusion of connection, because there's really nothing like hearing someone's voice and actually seeing them in person. So, I would be cautious about substituting time on social media for time in person or time on the phone with people you care about. And that's why I think those 5 minutes or so where you're talking to a friend or reaching out to a family member, let those be times that are tech-free zones in your life, where you're not checking your email at the same time, where you're not looking at the scores on ESPN, as I often used to do, or where you're not also checking your feed on social media. Just the more you can focus on the person in front of you, the deeper your connections can be. And that's where a little bit of time, again, can go a long way in helping us feel connected.
Yeah, it's really insightful, and it also informs programs we have like the Fox Grant program that actually helps fund community coalitions of veterans. The idea is that if you engage veterans and have them engage their battle buddies, their friends, the folks they served with, or folks that they may not have even known, but ultimately still identify with because they had similar experiences, that's actually protective for them individually, of course, in addition to the folks that they're talking to. So, a lot of our viewers are healthcare providers within our system, healthcare providers across the country who are interested in veteran health. What do you think the role is of healthcare providers themselves, including medical students, by the way, health professional trainees, in identifying and addressing loneliness and social isolation with patients?
Yeah, look, I think that the healthcare system and our nurses, our doctors, our trainees, they can play a really powerful role here. First and foremost, in opening up a conversation with a patient about loneliness and isolation. Even though many patients of ours are struggling with these challenges, they don't talk about it often, and they may not even think of them as health issues to raise with their provider. But sometimes when we just open up that conversation, it can do so much, even just to tell a patient that, you know what, you're not alone in feeling this way. And it's okay. It doesn't mean that you're socially deficient in some way or broken or that you're at fault. This is a common struggle for a lot of us in the modern world. So just even asking about loneliness and isolation can be a powerful first step. But there's a second thing I think that we can do in our healthcare systems, which is to start tracking and measuring loneliness and isolation, just like we measure and track the number of people who may have diabetes or hypertension or other illnesses. It turns out that that old saying, if you don't measure it, you can't manage it, is true in this case as well. That if we want to understand the true extent of loneliness, we've got to start measuring that, like in our communities. And there are now validated scales that we can use to do that. But one thing I do want to emphasize, actually two things, is that I don't think it should be entirely on the shoulders of an individual clinician to not only identify loneliness in a patient, but to solve that whole problem. And I think I say that because I do know that in the world of medicine that our primary care providers in particular feel like more and more is constantly added to their plate. Well, there's still only 24 hours in a day. So this is why I think the systems we set up around our nurses and doctors to catch and help and support those who are identified as struggling with loneliness is really important. Models like the social prescribing model that have been built in the UK, and I know there are experiments here at the VA and programs here as well. These are really vital to help ensure that once a clinician identifies somebody struggling with loneliness, that there's somebody who can then help them thereafter. But finally, I just also want clinicians to know that many of us in the clinical world are struggling with loneliness ourselves. And that, I think, is actually one of the less spoken about but important contributors to burnout. You know, as human beings, we can tolerate and deal with a lot of adversity when we're together, when we feel like we've got people who have our back and who are supporting us. But when we're alone and we're feeling isolated, then sometimes even normal levels of adversity or routine levels can feel overwhelming. And so I think that for clinicians also to be able to invest in their connection with one another, so they have a community, for institutions to support clinicians in having the time, structure, and space to connect with one another, that turns out to also be really vital in helping prevent burnout and ensure we're addressing loneliness among the clinical staff.
Yeah, we hear that all the time from not only our primary care providers, but healthcare providers across the country, especially in the area of mental health. You know, a lot of what we bring forward as clinicians is therapeutic, it's for the person you're serving. But it can often be taxing on the clinician themselves, and I do hear that from our staff. So I really appreciate you making that point. And you mentioned the UK model, the Compassionate Contact Core program is something that we modeled off of that, but also made it very specific to what we know in terms of messaging and strategy can work for veterans. It's a virtual social prescription program, trained volunteers, almost all veterans themselves, reaching out to veterans experiencing loneliness and who feel socially isolated. And so the volunteer contacts the veteran via phone or video calls to provide that personal touch and socialize and generate a companionship. And we've seen success with that. Have you seen models similar to that in the US that we can learn from and models that you've seen as particularly effective?
Yeah, well, I have actually, but one question I'm curious about is what have you learned about the impact on the volunteer, on the person who's actually making the contact with the veteran?
I love that you asked that question because, this program, but also our programs to end veteran homelessness through different grants that we give to community providers to place people in transitional housing. We have peer support specialists that we've hired full-time to help folks get into treatment for substance use disorder, mental health conditions like PTSD, have that lived experience. They overwhelmingly tell us that that is part of their therapy. Their service is part of the therapy for themselves. And so it's just a very, very inspiring thing, and we're seeing it with this program too.
That's really powerful. I think that mutual benefit is incredible, and it's something I think is so important for the recipients of the care and the contact to know as well, because sometimes it can, I know some people don't want to feel like it's a one-sided relationship, they're the only one getting help, but to know that the person doing the helping is being helped themselves is powerful. One of the programs I'm reminded of as we're talking is one that was actually built by a mutual friend of ours, by Sachin Jain, when he was leading Care More Health out in California. But I remember going out to visit them years ago and hearing about how they were deploying people to go and to actually call and spend time in person with some of their older, patients who were struggling with loneliness. And what was so interesting is that they discovered things about them just in the course of routine conversation that had never come up in their visits in the hospital. So, for example, I remember one story they told me about an elderly woman who had become more and more isolated over time. And they weren't quite sure why until one of these volunteers in her conversations realized that she had developed trouble seeing, and all of her phone numbers were in a handwritten diary that she used to keep, a phone directory, if you will. And she couldn't see those numbers anymore. And that's why she wasn't calling anybody from her home. And so the big intervention was they got her visual correction. They got her, the tools that allow her to see those numbers, and then she was able to call her friends and reach out and be connected, and that became a lifeline for her. But these seemingly simple things, sometimes we just don't know unless we like have a human conversation with someone and have time to do that. So that program struck me as a very powerful one. And to your point about the impact on the people actually doing the volunteer contacts, when they at CareMore were having trouble staffing, the needs and getting enough people to actually do the contacts, they actually found that their current staff who were doing other jobs started volunteering to do this. And they were surprised by that initially, figuring out they have a lot on their plates already. But the word on the street became that, wow, doing this, having these conversations is actually therapeutic for the person doing the outreach. Yeah. And so people really enjoyed it and they wanted to be a part of it. So I think these types of programs are really powerful, not only because they help the individuals who are struggling with loneliness, but given that so many of us are, being able to serve other people in this way can be really therapeutic for us too.
Yeah, it's so true. I was just at one of our vet centers in New Jersey. We just opened up a new one in northern New Jersey. And this is a system of care that's actually veteran to veteran. We call it readjustment counseling. And the culture in our vet center system is incredible. It's really, what do you need? What is your life goal? And let us help you get there. And often that means referring into the healthcare system, which is intentionally separate. Very interesting history behind the vet centers formed right after the Vietnam War, when the VA and the country more generally wasn't as supportive of those soldiers coming back home. But even today, it's helpful for folks to have that veteran-to-veteran counseling and the insights that you have as a veteran in that system both helps the person you're talking to as a patient, but also keeps our staff going in a way that's really empowering. So just love the theme here. You mentioned a little bit earlier, there are things that government can do, policymakers can do. VA has a really important voice in Congress. We, really try to push for public health and policy initiatives that help the well-being of veterans. So what can these broader bodies do, and people in general as part of those bodies to actually make better policy on this?
Yeah, I'm glad you asked, because I do think there's a lot we can do from a policy programmatic perspective. I think number one, being able to raise these issues with policymakers and put them on the map as issues that are just as important as diabetes and heart disease, I think are really vital. And I'm so glad you're helping do that, here at the VA. I think the other thing we can do, though, is we need to invest a lot more in research. The VA is a powerful research, force in our country, but we need to research more to understand more about which groups are particularly at risk of loneliness and isolation, what interventions actually work to address loneliness for specific populations, and that takes research, funding and focus. And so that is a place where I think policy can make a difference. But when it comes to policy and programs, I also think that, just like you mentioned, the vet centers in communities, I think of that as part of the social infrastructure in our communities, which we are now called to rebuild. People are used to thinking about infrastructure in the form of bridges and roads and sidewalks, but our social infrastructure are the structures and policies and programs in our neighborhoods and communities that actually help us come together and build healthy relationships. And that's everything from vet centers, like you mentioned, to green spaces, to organizations that bring us together. Now, traditionally, a lot of those organizations used to be churches and synagogues and other houses of worship. They used to be recreational leagues, volunteer associations. But participation in all of those has decreased over the last half century in America. And so we now need to rebuild those, create spaces and places where people can come together again. Maybe one last thing I'll mention has to do with not just veterans, but with their families. So in the time that I've spent with many of our active duty members and with their families, I've heard very clearly and consistently from them how difficult it is for families when they're moving around constantly to actually build social connection, to have a sense of community, and to keep and maintain that. And so even after, someone comes out of active duty and once they, are out as a civilian again, it can be hard for their families as well to figure out how do we now rebuild a sense of community after having moved so much and lost so many of our connections. So I think just as we take care of veterans, I think being able to have programs that include and care for their families in terms of building social connection becomes vital, because if anyone in the home is struggling with loneliness and isolation, that can be challenging and stressful for them. It can also be a source of stress for others in their family. But if we can support all of them in building community and coming together and having each other's backs, then the whole family can thrive. And as you know, we don't exist as individuals. We exist as part of a family, part of a neighborhood, part of a community. And so we've got to lift up the whole family in this process.
It's so true. You know, we changed our mission statement recently to update it to include families, caregivers, and survivors. I often hear veterans tell me that when they signed up to serve, they signed up their spouse, they signed up their kids. Everybody experiences it and is there for the veteran. And so we're definitely expanding the aperture of who we try to help with all of our programming. I'll just do one last question. You know, what have I not asked you about? But more importantly, what message do you want to send to veterans about this issue and, you know, resources that may be available to them, the VA can help with, or otherwise?
Well, first, I want all the veterans out there to know that, you know, in addition to being grateful for everything they've sacrificed for our country, I think that we have an ongoing duty to care for them that extends well past their time in service. And I know you believe that. I certainly believe that firmly. But part of that, you know, involves making sure we're caring not just for their physical needs, but for their mental and social needs as well. I also want vets to know that if they're struggling with loneliness or isolation, that is not a source of shame. That should not be something that they're embarrassed about, that this is incredibly common. A lot of vets, a lot of people across the board struggle with this. I certainly have over the course of my life. And it's just a part of being human. Just like we feel hunger or thirst when we lack food or drink, when we are lacking in human connection, we will feel lonely. And that happens to all of us. And we've got to be there, have each other's backs here. The last thing I just want to say to vets is that it's just to emphasize again that asking for help, no shame in that, but also knowing that you can be a source of help to others who are struggling with loneliness is really vital. If there's one common thread I've seen among all the veterans I've met, it's been their value for service. That's what brought them, to serve in our forces to begin with. It's I believe, a value that still runs through their bloodstream. And being able to serve, a fellow vet, by simply, again, reaching out to them for a few minutes a day, checking on your former battle buddies who will always be your battle buddies. These are small steps that we can take through which we can continue to serve and make a difference in other people's lives. And so I'm grateful to you, Sharif, for the leadership you're bringing here at the VA to helping shine a light on this issue, but also to build programs like the Compassionate Contact Corps, which I think are really vital ways for us to rebuild community. We might think that these things should just happen, people should just find these connections, but in the modern world in which we're living, where cities are sort of cut up, where technology has actually pulled us apart in interesting ways and separated us, we actually have to be more intentional about this. So that's why I think the programs that you're talking about are so important. And maybe finally, I'll just say on the issue of social media, which we touched on briefly. You mentioned kids, as being a part of the commitment, that the VA now has, not just to the vets, but to their families, including their children. Our kids in America are going through a youth mental health crisis right now. We have seen rising rates of depression, suicide, and anxiety among kids. We are seeing this going the wrong direction, sadly, and there are a number of reasons why. But one of the reasons that has cropped up has actually been social media as an important contributor to many of the harms and stresses and strains that our kids are experiencing today. And so I think for vets out there who may have kids and who are looking at their children and who might be worried about their mental health and well-being, I think it's important to know this. We published a Surgeon General's advisory last year on social media and youth mental health, as you mentioned earlier. But it was particularly to call attention to these harms, to call on Congress to actually put in place safety standards to help protect our kids from the harms of social media. But it also was to lay out steps that we can take as individuals and as parents. We can draw boundaries around the use of social media in our children's lives to protect sleep, in-person time, learning, and physical activity. Those are the 4 areas in our kids' life that are really vital to their development, but that are being encroached on increasingly by technology. And if we can do that, we can help our children. I know that there's a two-way relationship between a child's mental health and their parents' mental health. When our kids struggle, that affects us. When we struggle, that affects our kids. So I mentioned this as one way that we can help our kids, and through that, hopefully give ourselves a bit more peace of mind as well.
Yeah, really important advice as we bring entire families into the fold here in our services to veterans. And, Vivek, you've been just an extraordinary public health leader. You helped us navigate the pandemic and have now brought some of these really important, pervasive social issues into the work of public health. And it's just been really inspiring to see that. A lot of our programming has been really informed by that. And I just want to thank you tremendously for coming in today and speaking to us. And to the veterans and healthcare providers listening to this and watching, we really want to take a much more active role in trying to tackle the public health issue of veteran loneliness. And I think we got a lot of insights today, but know that we are always listening to your ideas. The frontline, treating veterans, seeing veterans every day, your voice matters the most. And we really appreciate that and hope to get a lot more ideas from all of you. So listeners, stay tuned. In just a few moments, I'll be chatting with Vietnam veteran Lieutenant Colonel Randolph Long about how VA's Compassionate Contact Corps program is helping him overcome loneliness. Thank you again to the Surgeon General of the United States for joining us today.
Thanks so much, Sharif, and great to be with you.
If you're a veteran in crisis or concerned about one who is, contact the Veteran Crisis Line to receive 24/7 confidential support. You don't have to be enrolled in VA benefits or healthcare to connect. To reach responders, dial 988, then press 1. Chat online at veteranscrisisline.net/chat or text 838255.
And we are back with Vietnam Army veteran Lieutenant Colonel Randolph Long. Randy, thank you for joining us. I want to start off with a little background about your service. You served the country honorably during the Vietnam War. Can you tell us a little bit about yourself, your service, what brought you to serve, and anything else you want to tell us about your life?
I received a draft notice that was dated April the 1st, 1966. Subsequently, April Fool's Day has never been a big holiday of mine since. But at the time, I was attending college at Morgan State College, which is now Morgan State University. So I went into service in April of 1966, completed basic training, AIT, at Fort Jackson, South Carolina. Subsequent to that, I went to officer candidate school at Fort Benning, Georgia, and I was commissioned as a second lieutenant in April of '67. I spent several months on base at the Basic Combat Training Battalion for new recruits coming in. Also pulled a month's tour at the Post Stockade there at Benning. I went in country in Vietnam in December of '67. I came home in December of '68. Apparently, I made it just in time for the Tet Offensive in '68, not completely realizing the magnitude of that particular offensive. But I spent approximately 6 months with the 25th Infantry Division as an infantry officer assigned to a infantry outfit, and was reassigned within country from the 25th to a MACV assignment. And I made it home in December of 1968. And I separated from active duty in April of '69. Got a pretty good exposure to military and the Army. I recall going to post headquarters to find out what the Army had in store for me. And the clerk indicated that, well, you've got enough time and grade that you'll make captain. I said, oh, that's pretty good, go from first lieutenant to captain. And he said, then you'll get command of a company, as opposed to being a platoon leader. I said, hey, this is pretty good. And then he said that you'll go back. And I was a bit confused about this go back piece. I said, what's this go back? He said, you go back to Nam. I said, oh, is that a fact? So it was at that point that discussions were held with the wife. And like I said, I came out in April of '69. I figured that one tour, was about it, Saw a lot, heard a lot, and you certainly learn a lot about yourself,
Yeah.
Not invincible, not invulnerable, all that kind of stuff. Yeah.
Well, look, I think, you were part of certainly a historic moment with the Tet Offensive, and, you were deployed certainly to defend our freedom. And that's something I deeply, deeply appreciate, Randy. Listen, you got connected to an important program of ours, which is the subject of our conversation today. It's called the Compassionate Contact Corps. Can you tell us a little bit about, what you were experiencing before our program was there for you, and ultimately what led you to be part of the Compassionate Contact Corps?
Now, when this particular program was first presented as being available, my concern was that personally, I didn't want to become isolated. Now, growing up in the family that I did, I was probably the one that was the quietest or, shy, whatever. So it's not easy for me to, step out of my comfort zone. But one of the things, like I said, that attracted me, that interested me, was the fact that I would be interacting, with individuals more so than I would if, in a sense, left to my own devices. Okay. And it was explained to me that the program relied quite heavily on telephone communication, which is fine with me, no problem. And indicated that the person that I would be speaking with, they too had volunteered to participate in this program. And over the certainly past several months that I've been involved in the program, it's like my scheduled time is on Thursdays at 12 o'clock. So I've gotten to the point that kind of sort of drop everything else, make sure that I'm available, and usually runs about an hour, and end up talking about a whole lot of stuff, some of which is directly related to my experiences in the military. A young lady has heard of many a war story that I don't think she may have been expecting, But one of the things that has come up, let's see, I have a grandson who last year graduated from medical school at Temple University.
Congratulations.
Well, the young lady that is assigned to me, okay, she'll be entering medical school shortly, within the next month or so. So that kind of, established a connection, a thread, and just to flesh it out a little bit more. As far as family, there was 6 of us, 3 boys and 3 girls. Now, my oldest brother was a doctor, and he served in the Air Force as a flight surgeon. And my other brother, he was in the Air Force also. And, did nothing truly outrageous as far as his career in the Air Force. And then when, like I said, the draft notice came and all this, here comes Vietnam, like they had nice military experiences. But I guess what I'm saying is that there was that history of family service. I had an uncle who served during the Second World War as a driver in the Red Ball Express, and he was injured, resulting in him being a quadriplegic. And so there is family history of service, but to bring it forward in terms of the program, I was making some observations in terms of how much contact, I was having, with friends and family. And I just didn't want to, end up, separated or, not having the contact with friends and family. And certainly the program, certainly as how I feel, the program has assured that no, I will not become, isolated. There will be not only contact with the program, but the program also makes me stay engaged with those people who are, friends. And then certainly I've lost several, friends over the past years. And like what I was saying earlier in terms of family, there's 6 of us. Well, 5 of us are still here. My oldest sister is 92 years old. And I just celebrated a birthday where I'm 79. I really tried to rework those numbers, but they wouldn't kind of sort of change,
They only go
I
one
don't know if
direction.
it's
Right?
new math, old math, whatever you want to call it, but somebody said, had made a comment that, you guys are getting old. Somebody else responded, getting, we're already there, so, like I said, I try to as best I can to, stay active, stay moving, stay involved,
Good.
as opposed to just sitting around. That's too easy to do. So when the program was presented as an opportunity to, take advantage of that list of services that are available to veterans through the Veterans Administration, I said, yeah, I'll do it. I didn't have any difficulty making that decision.
Well, we're glad you did, Randy. And, I really appreciate you telling me how much the Compassionate Contact Corps program has helped you. I just really have one more question. You ran through a lot of what I wanted to ask you about. But what would you like to tell other veterans about the program? Would you recommend the program? And, why should veterans consider participating?
Well, you know, for other veterans or comments to other veterans, sometimes those individuals, family members or friends who themselves don't have or did not have a military experience, they may not fully grasp what you went through just, being in the military, because a lot of veterans, if they find that you aren't also a veteran, they really won't talk to you. They really won't share with you. And it's a thing that you get very much accustomed to, almost like being in charge. And if you're presented with a problem in life, I'm going to handle this by myself, my resources, my energy. And no matter how frustrating it becomes to do that, you keep on, trying to do it. At some point, you realize that as much as I can do by myself, I can't do everything by myself. And this is the program is an alternative to, trying to move this big, bulky refrigerator by yourself when another person or two or three makes it easier. My advice or suggestion or recommendation to other veterans, regardless of branch, service, conflict, is that it's not going to hurt you. It's not going to hurt you. It's not going to be something that's going to be harmful to you, but quite the opposite. It's really going to be of benefit to you. Maybe a little bit, maybe a whole lot. But it's a tool that's going to enable you to, for as long as you can, get the most out of the life that you have left to live, because there's going to come a point in time where all those things that you are able to easily and readily do on your own, you're not going to be able to do no more. I mean, something as common as driving. I can still drive, Was out the other day washing the car. I said, ooh, no wonder car washers are making a lot of money, But what I'm saying is that it's another tool. It's another tool that will allow you, enable you to live a better quality of life.
Well, that's terrific, Randy. And I just can't thank you enough for sharing your story, for serving the country so honorably, and for trusting us with your care, not only your health care, but participation in this program. We really want to be there for veterans in every possible way, both with their healthcare needs and their social needs. And the fact that you're telling us that this program has been able to help you really means the world to us, and your recommendation to other veterans really, really matters. So thank you again, and this has been a great conversation. It's been good getting to know you, and please continue trusting us with your care. We're going to do our best to keep at it, keep you healthy, and really appreciate your time today, Randy. Thank you so much.